So now I'm going to start our next session. It's going to be a roundtable that is going to talk about COVID. Lessons learned for the future. We're going to have Rosanna Peeling from the London School, Alex Costa representing UNICEF, and Marcela Abreu representing Anvisa. I would like to invite Rosanna to do a quick introduction on the topic, and then Alex, and after that Marcela will make their initial remarks, and we end the session with all three of them together so we can have a final discussion. So Rosanna, the floor is yours.
Great, thank you very much. And I'd just like to start by showing a few slides to illustrate how very practical lessons that we've learned from the pandemic. And it's often said that pandemics actually don't create new problems. They just make us face the problems that we've long ignored. And so we've seen in every country, whether it's a rich country or poor country, that COVID has really exposed the fault lines in the healthcare system and all the inequities in access to life-saving commodities, which include diagnostics and medical devices, drugs, and vaccines, as well as PPTs, etc. And that the general lesson from countries is that they need to be building self-reliance in the manufacture of these life-saving commodities. But then not every country could do that. Maybe it could be done on a regional basis, and it must be done with really good quality standards. And then a third very big lesson for all of us is that when we talk about public health, we used to say, you know, public health conditions or messages, we just need to convey them to the public. We tell the public what to do and they'll do it. But we learned from the pandemic that this is not true. The public should really be given the knowledge and the tools in order to be more responsible to do their part in the pandemic. Now, just very concrete examples of what we could benefit from the pandemic and for building a more stronger antimicrobial resistance program. As I mentioned in my previous talk, you know, the pandemic has really pushed back a lot of progress we've made with antimicrobial resistance programs because so much antibiotic was given to COVID patients. But there are good things that we could learn from the pandemic that we could use to build a stronger antimicrobial resistance program, such as messaging, you know, to make people aware that global crisis can happen and it would affect all of us. And because we still have many people that are not aware of antimicrobial resistance. And then the kind of messaging skills that governments and other partners have honed in order to bring about behavior change. We could use the same thing to bring about behavior change that are needed for antimicrobial resistance. And then for One Health approach, we've always said that for antimicrobial resistance, we need to work with the animal sector, agriculture, and the environment. And now with pandemics, we know a lot of the viruses come from the animal sector. We need to be doing sewage monitoring rather than individual patient or individual monitoring in communities. Doing that kind of approach is a new way that we should be working at. And then building capacity, as I mentioned before, we've seen that we can now have the convergence of technologies for diagnostics, IT, and communications to build these dashboards so that everyone can be aware of the progress we're making or not making, and also to monitor how effective interventions have been. So I think that in terms of, in general, for diagnostics, we want to advocate countries now that you know, we're trying to cope with living with the virus. We need to think about building a diagnostic system that is connected from the top to the bottom from the very sophisticated reference labs to point of care testing facilities in the communities, or even self-testing. That whole connected diagnostic system should form the backbone of a strong and resilient healthcare system that would provide equitable access to diagnostic testing and screening, better clinical care and rational use of antimicrobial medicines, and that, with apps that clinicians can use to look at the local epidemiology of a particular disease, we could actually help clinicians to make better decisions because they can interpret test results in the context of the local epidemiology. That system would form the eyes and the ears of the healthcare system to provide early alerts of potential outbreaks of anything that's unusual happening within the healthcare system, and that we have a dashboard that could help us daily to display the information that can inform the public and all the managers in terms of policy makers to help have a collective action on whether it's antimicrobial resistance or HIV or a particular disease or outbreaks. We need to have some means of working together, and that this connected system, as I said before, would allow testing data to be turned into real-time intelligence to inform control strategies. So in a very practical way, we've seen that the COVID pandemic, many countries have increased their molecular testing capability. They are now allowing more self-testing. They are building stronger surveillance systems in order to transmit the information more efficiently. And also they've now got really good skills for public messaging, for public health. And so these are things that would benefit in a positive way from now on. So that's the end of my presentation. Thank you.
Thank you, Rosanna. It's great to have this opening so we can evolve. And what we see is exactly a change in technology and change in the way we actually look at traditional businesses. And the pandemic can probably not have created this, but for sure they accelerated a lot. Agora eu gostaria de convidar o Alex Costa.
So I would like to invite now Alex Costa. He's responsible for the legislative issues at UNICEF. Alex is Brazilian. He is in New York. He was part of the WHO in Cambodia and other countries and has a brilliant career in diagnostics. So Alex, welcome. The floor is yours. Thanks for inviting, or for being here, and the floor is yours. You were born in Brasilia, right? I was born in São Paulo, grew up in Belo Horizonte, and then went to Brasilia. I'm trying to share my slides here, but I cannot see my screen right now. 1 second, please. I have sent my presentation to you guys as well, so. I sent it by email.
Instante. Oi? Só um instantinho.
Desculpa a inconveniência, não sei porquê. Eu não consigo nem ver a minha tela.
We apologize for that, and we will be back shortly. Here we go.
Bem, boa tarde, todo mundo.
Okay, so good afternoon, everyone.
I'll do the presentation in English because the slides are in English slowly so the translator will be able to follow it. Next slide. I think the first thing that comes to my mind when I think in terms of lessons for the future is that we have to learn the lessons from the past, which I think we're failing to do. So this slide here shows the timeline for viral outbreaks in the last 20 years. As you can see, there has been 16 viral outbreaks of public health importance in the last 20 years. And it seems that the frequency with which these outbreaks are happening is increasing. It could be because of better surveillance systems and data reporting. It could also be a combination of factors since we're accelerating habitat degradation, increasing animal farming, and creating opportunities for zoonotic diseases to jump the animal-human barrier, combined with the fact that we're traveling globally more than ever, which really increases the probability of exposure to emerging pathogens. But in all this, the point I wanted to make is actually at the bottom, that in spite of the fact that we all know that diagnostics are absolutely key or is an essential tool for outbreak response, outbreak control, diagnostics have remained neglected as an accessory tool in the public health system. Next slide, please. So we know the diagnostic tests are essential, and I think Rosanna just mentioned this, that they are basically the eyes and the ears of the current pandemic. Without diagnostic testing, we do not know who is infected, how the virus is spreading, and how it's mutating. And even people who are aware of diagnostics sometimes fail to understand the diversity of roles that diagnostics plays in disease surveillance. And actually, there are two main roles. You can think of patient management, which is patient diagnosis and treatment, and then the other one would be the public health element of diagnostics, which involves contact tracing, surveillance in order to detect outbreaks, the genetic epidemiology to identify variants and to determine the vaccine efficacy. Diagnostics are critical for safety in schools, in the workplace, and in travel. And it's also from an immunity point of view to determine the epidemiological status of the population, actually to determine the immunological status of the population in order to inform, let's say, the rollout of vaccines, as well as to determine whether immunity is waning and to introduce boosters. I think we all have a responsibility to educate people around us, especially those working in the public health system, about the different roles that diagnostics have to play. And unfortunately, what we see happening now is, at least in the response to COVID-19, is how dominant the vaccine narrative has been. Sometimes I ask people, how many vaccines or vaccine doses have you taken? And how many times have you been tested? Right there, you see the disparity. That some people have not even been vaccinated, but they've been tested many times. Others have been vaccinated twice and have had a booster 3 times, as opposed to sometimes a dozen or more different tests. Next slide, please. So one of the things that we have learned in this response to COVID-19 that I think is quite important for the future is that we continue to operate within silos. We think in terms of diagnostics or vaccines or therapeutics or health systems, when in fact, what we really need is an integrated response. None of these tools will solve the problem. And the same will be applied for future pandemics as well. And in this slide, as an example, you can see diagnostics in the middle playing a role on one hand, for example, on the left side for therapeutics, to actually better inform treatment strategies. It goes from the preclinical trials in which you basically have to diagnose the status of the patients before you enroll them in the trials, but all the way to test and treat strategies, which are very important right now, because if we misuse the new antiviral drugs that are coming into the market, we're likely going to see the emergence of drug resistance very clearly, very, very soon, as we have seen for HIV and antibiotic resistance. And on the right side, you can see that the use of diagnostics is quite important for vaccine deployment as well. Before the availability of vaccines, they're important to the development of preclinical trials and clinical trials, and ultimately, it's quite important as well when vaccines are limited to inform a more effective vaccine deployment strategy, where you first vaccinate people who are more vulnerable or who have not been exposed to the pathogen. Next slide. The other element that we have seen in the past, and we see this more than ever before, is the importance of integrating social sciences into the response. You can't see the elements that are shown on the left, but I believe you're going to get the presentation, so be able to see it. But in the context of the ACT-A accelerator, UNICEF has been mapping a number of different factors, a number of different challenges for the uptake of diagnostics for COVID-19. And many of these are directly related to the epidemic of misinformation that we are facing along with the pandemic of COVID-19. So it really speaks about the importance of deploying an advocacy and communication strategy and engaging with communities in order to understand the drivers of their behaviors, to address that, the diagnostics hesitancy, as well as stigma and discrimination that could be associated with a positive COVID-19 diagnostics or with a positive test result from whatever disease. It's important to educate people in general, and very importantly, decision makers on the rules of diagnostics, and to promote testing as an essential part of the response. Next slide. So another thing that it's very critical at this point is it's necessary, absolutely necessary to increase investments in diagnostics. And these investments go in a number of different directions. So we need investments in research and development of diagnostics, specifically molecular diagnostics, such as PCR and genomic sequencing, that can be quickly adapted to respond to emerging pathogens. As we have seen, the first tests to become available were PCR tests. The machines are globally available, and it's a test that's very easy to adapt. The second element would be to invest in digital technologies to support diagnostics. That includes interpretation of results when it's not very clear and subject to error, human error, quality management of these results, data management. It's very important for the results to be reported back to national authorities in order to monitor the epidemiological situation of what's happening in the country, for supply management, among other reasons. The third element of investment here is point of care testing technologies, such as in this specific case for COVID-19, antigen RDTs and self-testing, because that allows decentralization of testing outside laboratories, outside the healthcare, and it increases access to testing, let's say at the community level, for example. This is something that there's a big push happening right now for COVID-19, but it's something that we're learning is very important going forward. And the last element here is investment in the ecosystem around diagnostics. You can't really sustain diagnostics or decentralization of diagnostics, for example, if you don't invest in the systems that are necessary to support it. So specimen referral and transportation, human resource capacity and task shifting, supply chain management, data management, biosafety are some of the examples. So here's another example of a lesson that we haven't learned. Human resource capacity for diagnostics has been a problem for decades, and it has been a bottleneck in many responses we had before, And this is happening again. Even with the technology available, the costs dropping, we're facing a bottleneck in low and middle income countries, which is the lack of a labor force that is capable of performing the diagnostic tests. It's not sufficient to have enough tests if you don't have enough people, if you don't have a career path, if governments do not invest in their own labor force in order to enable a faster response. Next slide. There's this saying in English that we're building the plane while we fly it. This is what's happening now with COVID is a very good example of how challenging it is to understand how to effectively deploy diagnostics when there are so many unknowns. We have so many questions, and these questions continue to emerge on a regular basis because we're dealing with a very dynamic situation, a disease which is a moving target, a pathogen that's constantly mutating, and diagnostic technologies along with other technologies that are constantly being developed as well. So in some ways, this has taken some of the credit away from the science, which is not accurate, because I think it's very important to understand that we do not have many answers, but that's the reason why it's so important to invest in operational and implementation research to help inform the deployment of diagnostics, the development and deployment of diagnostics as we are responding to outbreaks and pandemics. Next slide. I think the other lesson that we have learned, and it's quite important for the future, is that the process of development of international guidance, which is led by the WHO, may not be as fit for purpose for a situation like this with COVID-19 and such a dynamic situation as it is for a situation that is not as complex as dynamic as this one. I think there were several moments, and we're still facing this, in which countries and governments are begging for more guidance on how to utilize diagnostics and other tools, but the process for development takes such a long time, and it's based on evidence that's published in peer-reviewed journals, for example, that it limits the speed at which guidelines can be generated. And this could cost many deaths, because in absence of evidence, in absence of guidance, actually, in absence of guidance from international organizations, many countries will try to do the best that they can, which may not be appropriate. So I think there's a need for a more agile guideline development process to deal with a situation that is as dynamic as a pandemic is like this. And next slide, and I think that's my last one. And I think the last point going forward, it's something that Rosanna has just mentioned, is the importance of adopting a One Health approach. This pandemic has really exposed how the animal, the human, and environmental elements of human health, of One Health, are all interconnected. And I think the importance of diagnostics, although we're mostly talking about it here in the context of human health, it's really something that should expand to address animal health as well as environmental health. I think diagnostics has a much bigger role to play. And it is only when we adopt a One Health approach that we'll be able to effectively prevent and tackle some of these challenges that we're going to have going forward. One of the most important ones is antimicrobial resistance, as Rosanna just mentioned, which is really cannot be effectively addressed without a One Health approach. So that's one of the last points I want to make in terms of lessons learned. We have to adopt a One Health approach going forward. I'll stop here, and I'll be happy to join the panel discussion. Thank you.
Excellent, Alex. Thanks a lot. It's really a great presentation, great topics that you have brought, and I'm sure we're going to have a lot to discuss soon after Marcela's presentation. Marcela Abreu, gerente de diagnóstico in vitro da Anvisa, grande colaboradora da Aladiv também, já há vários anos, tem feito essa grande jornada conosco. E a Anvisa, este ano, mais do que nunca, esses 2 últimos anos, ela se esforçou.
Anvisa has worked really hard in order to make advancements and to ensure access to faster tests to the population. So, Marcela, the floor is yours. Thank you very much. Thank you, Carlos. First, I would like to greet everyone. I would like to greet the event organizers and thank you for the invitation to talk about the lessons learned when it comes to COVID-19. I don't know if my presentation already. I think it's working. So thinking about the lessons learned, this is always a great opportunity for us to remember that these are lessons that we have learned so far. Learning is a continuous program. We're still learning about this. So when we talk about new etiologic agents, as well mentioned by Rosanna and Alex, we are talking about situations that are part of development and they're part of our interaction with the environment. So we have very clear memories of other battles we had to face with the arrival of new etiological agents, and they are part of our recent memory. Maybe they were not valued as much as coronavirus was. So we have HIV, which also have an global importance. Between 2003 and 2006, we have the avian flu. The situation.
Empenho para a gente conseguir administrar, né, e controlar quadros como esse, as arboviroses, né, que nos anos de 2014 e 2015, além da febre amarela e da dengue, que já eram de grande relevância, principalmente para os países tropicais, a gente
especially in tropical countries, regarding chikungunya and Zika virus that were very important because they led to microcephalia situations that were connected to this new agent. And also Mayara virus and new viruses that are coming up. So the coronavirus is not the first one and it's not going to be the last one that we will face as we see the evolution of these pathogens. So what we've been seeing with the COVID-19 situation and the differences between this and other pandemics is that we have bigger challenges due to the proportion and intensity that it posed and the changes as well. So regarding COVID-19, we've seen a global need for the resources for everyone at the same time. Together with that, we had to work on new etiologic agents in an uncertainty situation. So we do not know that microorganism that well, so that we are able to make decisions to make access available, both in identifying and also measures to protect the society. So we have to have a constant surveillance to monitor the microorganism and how the knowledge is being built. So a collaborative action is very relevant within that context. And the first big lesson that the COVID-19 pandemic brought is the need to work on flexibility. Like previously mentioned, that the importance of IVDs is huge because it's not only at the forefront. When we talk about IVDs, that's involved within the whole chain of this process. So both for control and diagnostics of an agent, as well as to develop control measures, and also monitoring the condition of a patient. There's also, on the other hand, the possibility to build knowledge so that we know more about the agent. We need to study it. We have to invest in research, and we have to use different products. So the importance of IVDs is at the forefront of strategic decision making, and it's important as well to monitor health as well. So regarding the regulatory environment, we've seen the prioritization of analysis. So the first thing we had to work on was to align the needs and access. Our starting point at Anvisa was to focus on the analysis of registration requests. When we started working on this framework, besides coronavirus, we had other respiratory viruses that were already known. And so we thought that we also needed a differential diagnosis. So we worked on current requests that we already had for coronavirus and other respiratory viruses, but with the increase in demand, we focused our efforts on products for coronavirus. So with that finding of an etiologic agent like that, we had as an option to identify the virus. We had the protocols that were shared, which was the CDC protocol and the Charité protocol that allowed countries to implement in-house methodologies, acquire inputs, and validate those inputs based on those protocols to be able to make products available commercially. We also had to work a second topic, which was agility in response. So we had a 15-day deadline to receive requests, and we were only able to meet that challenge due to the work of our in vitro diagnostics team. So we were able to meet that challenge, and we also worked with different bidding processes. So we were able to, make the products available on the market to fight the pandemic. We also identified the need to work on changing requirements, because with time we have more knowledge about a product, we are able to implement improvements, and we are able to follow up that evolution. Within a pandemic, we understood that some requirements had to be analyzed in a priority manner. Another thing that we worked on was the flexibilization on technical standards. With that, we were able to look at different contexts. We could not work only on registrations if we were not able to import the product to the country. So one of the main points that were involved in IVDs was the flexibilization and emergency use of products, so that we were able to analyze the product with limited sampling to authorize the product for the market within a year. Throughout this year, many companies were able to obtain more robust information about the product and convert that registration from an emergency use to a 10-year use. We also had to be flexible regarding the use of certain products because of the lockdown situation. And sometimes we were not able to conduct audits And that's why we were accepting information from other regulatory agencies. Import of essential devices also had to be flexible so that we were able to provide support to the market for those products that were considered essential. Pharmacies and drugstores also amplified their testing services, and that provided more capillarity in obtaining information about the health of the population. Within that context, we also worked to extend the expiration date of a product. Normally, we evaluate the stability of the product and we estimate an expiration date. Within the pandemic, we are talking about scarce resources. So if throughout time we are available to extend the expiration date, then those products have specific conditions and they are still, able to be used. So that flexibilization of technical regulation was very important for Anvisa as well. One other topic that we worked on was transparency. The access to information is essential so that we know and are able to make decisions based on data. And so we worked with BI panels that allow us to follow the demands received by Anvisa, understand the status of all the requests, have quick access to the consultation of products. We also thought of creating a chart of strategic decisions based on the type of sample, the type of product, the methodology used, which are the targets, and make that available on the Anvisa website, the instructions of use. We also worked on the program of monitoring the quality of products on the market. And that was an important initiative, both in terms of surveillance from the government and also the private sector to identify the need of this vigilance, because this is a collaborative work that has to be conducted by everyone together. So you can see this is the link to the panel. You can see it on the bottom of the screen. So here on top, you can see the timeline of the product, the time of response of the agency. You see the whole volume of information that you have of the products. And here's the status of evaluation of each product. So we have over 1,000 requests for registration of products. Of those, 70% were approved and 25% were denied. So in Brazil, this is data from November 23. We already had 436 products for antibodies specific for coronavirus, 107 molecular assays, and 145 antigen assays. This is a monitoring of the origin of the products. So you can see that we have several products coming from Asia and also an important participation coming from Europe. So now we see that there's an important topic as well, which is knowledge. We had to work on points that focused on technical and scientific update. So we worked on exchange of knowledge with product developers We had important meetings to meet those developers so that we had access to the knowledge and how the products were developed. We had meetings with regulatory agencies to understand the impact of variants and innovations on diagnostics products. We also had weekly meetings with our teams to exchange data. And we also worked on diversifying sources of scientific update. So technical update is something very relevant. And when we talk about risk scenarios and the evaluation, that has to be connected with communication and integration. So the first point was a need for everyone to adapt to working from home, and that impacted our work at Anvisa. And that has also to do with the integration of different areas that have interests in common. So we're talking about new stakeholders that are very important within the knowledge scenario regarding communication and integration. So we are dealing more with media, with the legislative and judiciary branches, the regulatory sector, researchers. So everyone is involved in this information scenario. We also have to follow up on international warnings. So we have to keep an eye on all the changes that are happening in the scientific context and the world scenario. So we have variants that are important, the issues related to the virus spread and control measures, and the profile of vaccination. So we have different stages within the pandemic. And so we have a technological trend as well, which is leverage, so to speak, to develop products like a type of point of care testing that we've seen grow in the sector. But now we've seen greater effort regarding that, and also softwares for medical devices and the use of artificial intelligence.
So I think that having said that, this is already part of the scenario, the whole biological setting. The need to adapt, it's a need to survival. We need to align these different elements. We need to realize where we are in terms of context so we can assess all the different issues that belong in such context and adapt to them. So adaptation is truly a matter of survival here. And I have a quote for you from a Brazilian philosopher called Mario Cortella. And I think this quote is related to the discussion we have had so far. There are no designated seats in the future. And for me, this is a reality when we talk about the diversity and how dynamic we are in terms of products and information, because the reality today can be completely different tomorrow. It can be surpassed. So we need to grow, we need to be flexible and adapt to the new experiences that we have. And I would like to leave you with another quote that could help us guide many of the decisions we make. It is a quote that should guide our decision-making process. But on the other hand, this is a good quote to provoke your thinking, because there's no single answer to it. Because every time I need to make a decision, what is the best way to go? So thank you very much. That's what I had to share with all of you. Thank you, Marcela. This has been an amazing discussion panel because of the quality of the messages that all three of you presented. You all reinforced the need to constantly reassess our position, and we have received many questions from the audience. So now I'd like to invite Alex and Rosanna to open their cameras again so we can have a quick debate with some of the questions that were sent. One of them talks about the role of the antigen test, not to the opening of borders, but for allowing a safe traffic.
Aqui do nosso Zoom, ele pergunta exatamente, o Bruno, os testes nacionais aprovados pela Anvisa têm validade para entrar em outros países?
Have been approved by Anvisa are valid when entering other countries. And of course, he's thinking about national tests or tests that are produced here, or tests that have been approved here, tests that have been tested nationally, and then passengers are leaving the country with the result from the lab or from a pharmacy. So Marcela, if you could take that one. Thank you for the opportunity to participate in this discussion, but first, I think we need to understand some important elements. First, as mentioned by Dr. Alex before, there are different criteria that are established in different countries. The product evaluation criteria are different. In Brazil, we don't establish minimum performance levels for these products because of the way we have worked when it comes to accessing these products in the country. So they are evaluated regarding to what the manufacturer has designed for the product and what is stated in the instruction of use. And when we talk about an antigen test in the coronavirus setting, because we're still trying to get to know more about the virus, the tests are developed for different portions of the virus. So what is the risk that we can have related to this type of test? When it comes to different variants, if the product was developed for a portion that could include part of that variant, there could be some failures in the results, but that doesn't depend on the place where the product has been tested or approved. If that happened in Brazil or in a different country, that is not really what is at stake here. So there are still risks when it comes to diagnosis. We still don't have a clear path. Molecular assays are still safer because they are more specific in the virus identification, but they can also present flaws. So I think a test that is conducted in Brazil and approved in Brazil, its acceptance varies because it might not meet all the standards of the country to which the person is traveling to. In my understanding, Marcela, a traveler leaving Brazil, if the test is done in Brazil, if it's of course an approved test, the standards to travel will be met. And I think Anvisa has had a very careful approach in the products that are being sold and used in Brazil, especially when it comes to the surveillance aspects of them. Our assessment program for the coronavirus kite, which was a group effort by different institutions, helped Anvisa to have a better understanding of the performance of these tests. And also the work conducted has demonstrated that the products manufactured in Brazil are of good quality. And once individuals are tested, they have the results from a qualified professional that could serve for traveling. But I would like to know now from Rosanna and Alex, how this works in other countries, because before there was a demand for PCR test plus a period of quarantine. But in more recent times, these measures have changed for a combination of an antigen test, in some countries even accepting a self-test, especially when they arrive at the country. So maybe if you could clarify a little bit more of that. Alex, please. Carlos, as you mentioned, we are evolving very fast and we don't have a golden standard yet. So as the different national regulatory agencies approve an antigen test or a self-test, they become part of the national policy. But we don't have a standard for that. And that highlights the value of a regulatory cohesion, especially from the regional point of view. So the thing is,
e a situação continua evoluindo de maneira muito dinâmica.
we're building the plane as we fly it, and the situation is still evolving. Rosanna?
Yes, I agree with what Marcela and Alex said. I think there are just too many countries with too many requirements that have become very confusing and complex. But one thing I would say is that if a country has approved a test for antigen tests or self-tests with a high specificity, because most of the antigen tests have comparable specificity to PCR, if not just a little bit lower, like 98% compared to PCR, then the negative predictive value of these tests become very high and are totally acceptable. And so what we need is a test, not to find a case, but to assure that a person is negative in order to travel or to attend an event, then antigen tests on the whole would suffice for now, even though we don't have very strict standards or international consensus on what to do. But I think that's the value. That's why antigen tests and self-tests have become so widely available, and people do use them just to assure themselves that they are still negative. And I think for most countries, if you're antigen negative, but we have reason to think that you have been in contact with the case or that you're symptomatic, then, and if you're antigen negative, then you should certainly go and have a PCR test done. But for most individuals in a community wanting to know whether they are negative or for the virus or not, an antigen test of reasonable specificity, such as 98% would, compared to PCR, would survive. And so this is what we can go on right now. Over.
Excellent. Nós temos trabalho muito interessante que é o
We have a very interesting work, something mentioned by Alex, with APTE. It's part of a group that is working in all three areas: therapy, meaning drugs and monoclonal antibodies, antiretrovirus, and vaccines, where we have had a great evolution, and in the tests as well. And as he has demonstrated, there is a trend to try to, or there's an expectation to acquire more than 1 billion tests, in its majority fast tests, for developing countries that still need to monitor the evolution of the disease. And this is something that is already happening. Tomorrow, we will have a presentation from FIND, and they will talk exactly about that. They talk about that from the technology point of view, meaning R&D, up until the discussion of going into consumers' home, using that context of an auto test, which is another available tool we have. In the case of England and other countries, they use that to complement the testing process. Individuals arrive and they can be tested at the moment of arrival, but they also take home some tests so they can check their status from time to time. So my question to you, Marcela, is how do you see this? How do you see the arrival of new technologies, so the point of care test, and how is Anvisa preparing in this technology horizon? And also thinking about new tests, new environments, a discussion that is being conducted by the review of one standard and the General Office of Services at Anvisa. I talked to the General Manager today, Guilherme, and he mentioned that pretty soon we will have a consolidation view on this discussion. But regarding the registration or the licensing area, how do you see the new technologies? And you've mentioned this in your presentation. We're not talking just about point of care testing, but we're talking about IT and the different softwares as medical devices for these new settings. Of course, not forgetting about the COVID auto test. Okay, so as I mentioned before, the point of care testing is a reality. It's here to stay. And it's a type of technology that is extremely relevant, especially when we talk about access, as long as it is used properly. So when we talk about point of care tests, there are some concerns from the regulatory perspective, and they include the professional training, the quality assurance controls that can be applied to these products. There is the issue of the infrastructure of the place that includes all the different steps of management and steps related to a specific infrastructure when it is required by these products, because some products do require a specific infrastructure. So we need to do preventive maintenance, for example, and we need to manage data and data privacy of users as well. This is also an important element when we talk about sensitive information. We even have this connected to the general law of access to personal data in Brazil. There's a need to monitor the results of these tests. So truly, it is relevant, it is important, but it is a segment that is growing. So our work is to minimize the risks or errors in results that could be connected to the product or connected to the way these products are used. So we need to do some adaptations in the regulatory context so we can advance in expanding access to these type of products. When it comes to auto tests, we're talking specifically about issues connected to public policies. We cannot introduce an auto test for a disease that has a mandatory notification without a policy to clearly know the purpose of doing that, because we are talking about a lay user that will use the product under conditions that they don't control. They don't know the type of product, because we have assays for antigens, we have assays for antibodies in the as auto test products. So what do we expect with this type of information? Because if we don't assess that within a public policy context, we can also have the contrary effect of the work that we have done so far. So this information might not be valid due to problems in the execution of the test or for an improper use of the product, and that might lead us to question government actions. It can lead to raising questions regarding vaccines, because if you do an assessment right after a vaccination, results can be need to be interpreted differently, or you might interpret those results as you are already protected. We need to know more about the immunogenicity of these virus, how long it lasts, what is the minimum level of antibodies that you expect, what is the decay rate that is expected. So all these situations need to be known. So the public health policies need to have clear purposes so we can understand how much expanding access to a non-expert audience, because I'm not talking about public services here, I'm talking about health professionals that are trained. But in this case, we are talking to non-experts, people who don't have the basic knowledge to identify these different elements. So this work needs to be connected to information campaigns and connected to a clear purpose of why these products are being used. So Anvisa is not eliminating this type of assessment, and we are open to have this communication and this conversation with public policy makers so we can find the best way to face the pandemic. Because in the end, we are all searching for the same goal. We want to have the best result we can in fighting and controlling the virus. Excellent, Marcela. Thank you for your comments. And my question to Alex and Rosanna now is, how can this dilemma between a non-expert audience and health professionals is being dealt with in other countries. Maybe Alex, you can start.
Rosanna, why don't you go first?
Okay, Alex. So I think that this tension between a top-down approach of a notifiable disease that you must have control of who's doing the testing in order to know how many cases there are. So we've seen that with HIV, right? We've seen that for years, we do use a top-down approach for these communicable diseases that are notifiable. But then we realize, in spite of all our efforts, that we will not reach certain populations that are at most risk of transmission and acquisition and transmission. And that for the purpose of having a stronger disease control program and be able to eliminate HIV as a public health problem, we needed to have self-testing. And recognizing that self-testing, it's only an aid to diagnosis, is not a diagnostic test in itself, right? We're not saying anybody who tests at home has a positive test, that's diagnostic. That's not true. It's only an information as an aid to a diagnosis, because that diagnosis needs to be confirmed. And so a lot of work had gone into how making sure that whoever does self-testing, if they have any questions, they have hotlines to go to, or if they have a positive result, they must seek care and to confirm the diagnosis, etc. So all that had gone through, I think, the last 8 years for HIV. And there's a lot of lessons we can learn from there. And because now the pandemic, COVID-19, is affecting everyone. It's a respiratory infection, it's affecting everyone. We need to expand that thinking to say, you know, if I were a person who had gone to a wedding where you think that there's not enough public health measures of distancing, or people were not wearing face masks, and you're in a hyper-endemic setting, when you go home and you have an elderly parent at home or grandparents, it would be good if they have access to a test, just so that they know that they could be comforted in the fact that they are negative, in order to be able to have not to have to self-isolate after going to an event like this, or to work every day, etc. So I think there are certain circumstances that could complement this, even as vaccines are being rolled out. I was once asked, if you were sitting in a plane for a long trip, would you rather be sitting next to a person who's vaccinated or a person who's been tested in the last 24 hours? And I'd say definitely tested in the last 24 hours. Because the vaccines are not preventing infection per se. And so, and people say, oh, what about a PCR test? But most countries require PCR tests within the 72 hours. And if I were working in a care home and constantly in touch with high-risk individuals, or care for, or in the hospital and care for high-risk individuals, within those 72 hours, there's a high likelihood that I may have acquired the infection. So I think there are all these different things that, you know, we can't resolve right now, but it's a matter of tolerance of risk. Every government has a different tolerance for risk. Individuals have different tolerance for risk. And we try to do the best we can. Alex?
Thanks, Rosanna. Eu gostaria de complementar algumas coisas que foram faladas. Por exemplo, a Marcela
I would
falou
like
sobre
to add a few points to what Marcela talked about self-test and what we've been seeing internationally, because everything is so dynamic. We know that these products are being developed and they're going to enter the market, and sometimes they are already in some countries. There is an effort of the Access to COVID-19 Accelerator to work with universities to model the use of self-tests in different situations, in different levels of transmission and different use cases. If you're doing that at a school or a community where there's transmission, or whether it's in clusters. And that will inform the policies and the implementation and the operational research that has to be associated with these tests so that we can confirm or refine the model. One other element that is involved as well, which is a synergy work, is the development of digital tools that may help, on the one hand, to reduce the errors related to the interpretation of tests, as well as help to inform the results to the public authorities of the country. If the results are read, for example, with an app on a smartphone, for example. So the idea is to help with the process of testing and interpretation of results and mitigate the errors that may be associated with that. And also, in general, the self-tests, as far as I know, are available for individuals. You can go into a pharmacy and buy one. It's not cheap, but it may not be accepted if I want to participate at an event or board an airplane. So the self-tests are for self-use, and if there's a positive result, or if the result has to be official, it has to be conducted by someone who's certified, whether it's in a laboratory or a drugstore, and has to have an official result. So the self-test is preliminary, not definitive, and it has to be confirmed by an official or agent or organization that is really certified to do that. Excellent, Alex. There are a lot of topics to debate, but one of the things that we are sure is that people stopped testing. In Brazil, we have been advancing a lot with vaccination, and so basically people think that they do not have to take tests anymore. So when Rosana said that in a plane she'd rather sit next to someone who is tested, because people sometimes, when they are vaccinated, they do not have the risk of getting infected, and that's not true. We've seen cases of infection and reinfection. So the test provides an early and precise information about the status of the person, and then you can adopt measures, whether it's treatment or contact tracing and other measures. So we know that diagnostics are the best tool. The tests, the way are being developed, when they are out of the traditional environment, they show the people that are invisible to the system. So now some people are showing up and they would not go to seek for care because they were not aware of that. And now they are going to the pharmacies, or they may go to a clinic, and they are going to seek care for people who are certified to do that. And so the self-test is an additional tool that can provide an alert so that people can take a different attitude. So we see that there are different technologies. What Marcela does, calling the policy makers, is very important. So now this event is an open space, these 2 days, to debate with people from Fiocruz. We've seen Claudio Majerovic already, asking questions. So we're going to have other authorities here. And so the idea is to promote to citizens, both visible and invisible to the system, the best tools. So with that, I would like to thank everyone. And I would like to leave the space open for final remarks to each of you. And we will keep working and we count on you. Thank you very much. Marcela, Alex, Rosana. So I'm going to start just by thanking you and congratulating you, because we have to have this space to debate these issues. Because if we only have one point of view and do not have other perspectives, those who develop a product have a purpose. Those who await a test result have an expectation. Those working in the regulatory sector have an eye for risk. So when we change our perspective for different points of view, then we're able to see things differently. So this is very important, a room like this one to talk about that, so that people are able to have more information about products, technologies, and applications, so that we're able to, question ourselves. What is the best way? What is the best decision, and why make that decision? Are we able to evaluate the impact and seek the best response? So I think this is what we really need, a room for debate, understand that there are differences when we compare, when I talk about an HIV test and a COVID test, these are different situations, but this is very important. And I would like to invite everyone to talk about anything, so that we make these rooms and spaces even more available. Thank you very much. Alex? I'm just going to repeat what Marcela said. I just, thank you so much for having me, for the opportunity to talk about something very important for all of us. And I'm really, really very impressed with the level of literacy, really, of regular people. So people know a lot more about diagnostics since the pandemic. 2-3 years ago, nobody knew what a PCR test was. Today, people who have no education in the health sector whatsoever are able to understand the differences and the limitations and benefits of each test. So this is an example of the opportunities that we have. Although the COVID pandemic has a huge impact, like an old Chinese saying, every crisis also poses an opportunity. So today, I think we have a huge opportunity to strengthen the diagnostic sector that were, exposed by the COVID pandemic. And so each and every one of us working in that sector have to recognize those opportunities to strengthen the diagnostic system, because the number of events, the number of infections and outbreaks and epidemics and pandemics is increasing, but the importance of diagnostics will also increase. So one example of that is the bacterial resistance, and it's a silent pandemic. It's been spreading for a long time now. And so my final remarks is that we working in the sector have to understand and see these opportunities to strengthen the system in the future.
Hi. So I'd like to echo what Marcela and Alex has already said. I mean, we're now facing a health environment that is so totally different than what we had before. As Alex said, we no longer can afford to work in silos. We need to have everybody understand everybody else's position. As Marcela said, everyone a company has a different perspective, the regulators have a different perspective, policymakers have a different perspective. So we need to, that's why we do these simulations to bring every different perspectives into the same room to try to, for people to understand the complex decisions that others have to make and be able to appreciate what the whole picture is. Then the other change in the health environment that's been gradually happening, but it's accelerating for us to face it, is the top-down approach versus grassroots up approach. And we now need to think about a combination of this and how to quickly learn about a different environment where we have both top-down and health grassroots approach work together. And so I really think this has been a really useful and very rich discussion that we could keep on moving forward. Thank you.
Thank you, Rosana. Bom, eu agradeço a todos. Foi realmente grande prazer ter.
Thank you so much.